specific type of birth control in mind?
Well, let me tell you this. This damn birth control pill, I cannot stand it. It just doesn't work for me. It's the reason that I have this baby right now. So I definitely want something that might be long-term or not, maybe not permanent, but just long-term that I don't have to remember to take every day.
Okay, absolutely. There are plenty of options besides the pill that women are using that are proven to be effective these days in preventing pregnancy. You said that you would like something long-term, and the etonogestrel implant, also known as Nexaplanin, and the depomedroxyprogesterone acetate, also known as the Depo-Provera injection, could potentially be the right fit for you.
Oh, okay. Well, what is the Nexplanon and what is the Depo-Provera?
The Nexaplanon is a single rod implantable device that goes into your inner upper arm, and it lasts for up to 3 years. The Depo-Provera shot is a contraception that is given as an intramuscular injection in the deltoid region, and it lasts for up to 12 weeks.
Oh, okay. Those options sound pretty good for me, but am I an ideal candidate for it?
Absolutely. I believe you're an ideal candidate for either one of these options because you're looking for a contraceptive that is long-term, that you don't have to remember to take every day like a pill. And they have both proven to be effective with minimal to no adverse side effects.
That's good, because like I said, I can't stand that damn pill. I cannot do it. I cannot deal with it anymore. So is there any way that you can explain to me how these different birth control options that you've explained, like how they work in my body? I'm just unsure about having a foreign object placed into my body, and I'm not sure about having injections given without a full understanding of the mechanisms of how they work.
I can most certainly explain to you the mechanisms of how these two different contraceptives work. I'll start with the Nexaplanon, which is a form of contraception that is used to stop the hormones, and it uses hormones to stop an egg from being released by your ovary, and it prevents the sperm from reaching the egg. As I mentioned, it's a single rod that implants underneath your skin in your inner upper arm, and the Nexaplanon puts a steady low dose of hormones into your bloodstream that lasts for up to 3 years. The Depo-Provera is a contraception that contains the hormone progestin. Progestin helps to prevent you from becoming pregnant by stopping ovulation and thickening the cervical mucus. When there's no egg, pregnancy cannot occur. With this form of contraceptive, it lasts for 12 weeks. And after the 12 weeks, you must return here to the doctor's office to receive the next dose that will protect you for another 12 weeks, and so on.
Oh, okay. That definitely sounds like something that I would be interested in. Do you think that you can tell me where I can obtain this birth control? And like, do I self-administer the implant and the injections? Can I get these medications from my Walgreens? Like, how much is it gonna cost me?
Absolutely. Those are some excellent questions you have, Sarah. The Nexaplanon and Depo-Provera are both administered here at the doctor's office by trained medical professionals. You can't get them at your pharmacy. It's just standard protocol to get them here at the doctor's office.
Yeah.
And most insurances will cover the complete cost.
Okay. Well, that definitely is some good information to know. How effective would you say that these birth control options are? And like, because I just definitely don't need to get pregnant again.
Well, the Nexaplanon is proven to be 99% effective, less than 1 pregnancy per 100 women who use the Nexaplanon for 1 year, which means it's just as effective as the pill.
Oh gosh.
Yeah, only because you didn't take your pills, they did not work for you.
Yeah, I just can't remember to take it.
Yeah, it's a bit of a hassle sometimes. Absolutely, I can agree with that. However, the implant is nothing that needs to be taken daily, weekly, monthly. It's just one implant that lasts for 3 years, and the Depo-Provera is effective, and that's depending on whether you return at that 3-month mark for your, following shots. If you don't show up after 3 months, then, there's a chance that you could get pregnant.
Yeah. So, I mean, that's good information to know. I mean, I guess you said that it's pretty effective in preventing pregnancy because, like I said, I just don't want any more accidents to happen.
Yeah, no more baby Sarahs.
So they're pretty effective?
Absolutely. The Depo as well as the Nexplanon, they are both 99% effective in preventing pregnancy.
That's good to know. Can you tell me some of the advantages and disadvantages of the Nexplanon?
Sure, the Nexplanon has advantages including its effectiveness, and it may help in reducing menstrual cramping. It's estrogen free. It lasts for up to 3 years, and it is reversible if you do decide that you would like to have another baby Sarah.
Oh, okay.
Yeah, absolutely. Some of the disadvantages that come along with the Nexplanon are headaches, breast pain, nausea, weight gain, ovarian cysts, pain or bruising where the implant was inserted, and an infection at the insertion site.
Oh, okay.
And they also do not protect against sexually transmitted infections.
Okay, that's good to know.
Yes, ma'am.
Good to know. That's a lot of information to consider. Can you tell me some of the advantages and disadvantages of the Depo-Provera injection?
Sure, the Depo-Provera has some advantages. It's also effective, and they help with reducing menstrual cycles. It's also reversible if you do decide to change your mind in the future. And some of the benefits include reducing the risk of uterine cancer and ectopic pregnancies. Some of the disadvantages are you have to remember to come back at that 3-month mark, as mentioned before. Nausea, weight gain, headaches, breast tenderness, depression, slight bruising where the shot was given, and very rarely a small dent in the skin where the shot was given seem to be some of the disadvantages. It can also take up to 10 months to get pregnant once you stop getting the shot.
Oh, okay. Thank you so much for clarifying all that for me. It's a lot to consider, and you definitely gave me a lot of good information. Is there any way that you can explain to me some of the risks and the precautions and contraindications, and maybe even some side effects from the Nexplanon and Depo-Provera?
Absolutely. For the Nexplanon, some risks include problems with insertion and removal, ectopic pregnancies, ovarian cysts, breast cancer, and blood clots. Some of the precautions include informing your doctor of blood clots and, avoiding smoking and limiting time in the sun, because this contraceptive method can cause blotchy, dark areas on your face and skin known as melasma. Nexplanon is contraindicated with women with active liver disease or liver cancer, or women who are already pregnant, and with women with a history of thrombosis or thromboembolic disorders. Some of the side effects include changes in menstrual bleeding, mood changes, back pain, and changes in appetite. For the Depo-Provera, some risks are, delayed return of fertility, bone mineral density may be affected, and some of the precautions include receiving annual physical examinations and reporting any depression. Depo is contraindicated with history of thrombophlebitis or cerebral vascular disease, and some of the side effects include depression, headache, nausea, fatigue, breakthrough bleeding, and amenorrhea.
Okay, well thank you so much for explaining everything to me about Nexplanon and Depo-Provera.
Nexplanon implant. Okay, then we would have a device, and this would just get inserted under the skin as so. And there is your Nexplanon. Clean the injection site. Alrighty, we're going in. Alright, no babies for you. See you in 3 months.